This vaccine is used to help protect people who are at high risk of smallpox or monkeypox infection. Smallpox and monkeypox are caused by a certain type of virus, orthopox virus. People who are at high risk may include certain lab, healthcare, or public health workers, and people who have been exposed to someone infected with one of these viruses. This vaccine works by boosting the body's natural defense, immunity, against orthopox viruses. This vaccine is made using weakened live virus and cannot cause orthopox infection. It can help prevent infection with some types of orthopox viruses including smallpox, monkeypox, and vaccinia. As with any vaccine, it may not fully protect everyone who receives it. Before receiving the vaccine, make sure to read all the vaccine information provided by your healthcare professional. If you have any questions, don't hesitate to ask. This vaccine is administered by injection under the skin by a healthcare professional, usually in 2 doses given 4 weeks apart. The injection is typically given in the upper arm. If you have received 1 dose in the past, you may only need 1 dose this time. It is important to closely follow the vaccination schedule provided by your healthcare professional and keep all scheduled medical appointments. You may find it helpful to mark a calendar as a reminder. It is also possible to receive this vaccine at the same time as other vaccines. Some common side effects of Jynneos may include redness, soreness, swelling, and itching at the injection site, as well as tiredness, headache, and muscle pain. These symptoms should be reported to your healthcare professional if they persist or worsen. Rarely, some people may experience symptoms such as fainting, dizziness, vision changes, or ringing in the ears just after receiving the vaccine. If you experience any of these symptoms, it is important to inform your healthcare professional right away. Sitting or lying down may help alleviate these symptoms, as they typically do not last long. It's important to remember that your healthcare professional has prescribed this medication because they have determined that the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. Although very rare, a serious allergic reaction to this vaccine is possible. Seek medical help immediately if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed here, be sure to contact your healthcare professional for further guidance. If you have concerns about side effects, it's important to discuss them with your healthcare professional. In the U.S., you may report side effects to the Vaccine Adverse Event Reporting System, VAERS, at 1-800-822-7967. In Canada, you may call the Vaccine Safety Section at Public Health Agency of Canada at 1-866-844-0018. Before receiving the Jynneos smallpox vaccine, make sure to inform your healthcare professional if you are allergic to it or have any other allergies. This vaccine may contain inactive ingredients that can cause allergic reactions. It's important to discuss your medical history with your healthcare professional, especially if you have a current fever/illness, immune system disorders, or certain heart problems. If you are pregnant, this vaccine should only be received when clearly necessary, so be sure to discuss the risks and benefits with your healthcare professional. It is unclear whether this vaccine passes into breast milk, so consult your healthcare professional before breastfeeding. Drug interactions can have an impact on how well your medications work and can even increase the risk of experiencing serious side effects. It's important to keep in mind that this list of potential interactions may not cover all possibilities. Make sure to keep a record of all the products you use, including both prescription and over-the-counter medications, as well as any herbal products, and share this list with your healthcare provider. It's crucial to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. Some products that have the potential to interact with Jynneos, PF, National Stockpile, 0.5x to 3.95x 10exp8/0.5 ml Subcut suspension smallpox vaccine include drugs that weaken the immune system, such as cyclosporin, tacrolimus, cancer chemotherapy, and corticosteroids like prednisone. Be sure to discuss any concerns about potential drug interactions with your healthcare provider. This vaccine is used to prevent smallpox, a potentially deadly disease. It is given to people who are at high risk of exposure to smallpox virus, such as laboratory workers and certain military personnel. This vaccine works by causing the body to produce its own protection, antibodies, against the smallpox virus. Make sure to attend all of your scheduled medical appointments and laboratory tests to monitor your response to the vaccine and ensure your overall health. This will help your healthcare provider determine the best course of action for your vaccination schedule and any necessary adjustments. Make sure to follow the vaccination schedule provided by your healthcare professional. If you miss a dose, consult your healthcare professional for a new dosing schedule. This vaccine is administered in a medical facility and will not be kept at home. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.